Welcome to aminacademy.com. In psychological abnormality, let us discuss about the definition and classification. Sometimes we ask ourselves, am I normal? I usually double check whether I have closed and locked the door or not, which seems like I may have the so-called obsessive compulsive disorder. I am also considered arrogant by Asian standards as I always speak my mind. Thus, some people consider me narcissistic. From time to time, I wonder whether I am normal. What's normal enough? The question is, by whose standard are you normal or abnormal? Depending on the society we live in, a behavior can be considered either normal or abnormal. In Japanese culture, honor is taken seriously, thus, any incident that hurts one's pride is worthy of self killing or suicide. In the United States, however, the first thought that comes to mind whenever someone kills himself is clinical depression. Thus, culture determines whether one's behavior or suspected psychological pathology is abnormal or not. Milder and somewhat accepted desire behaviors, for instance, may be called eccentric instead of abnormal. An artist who paints with his own saliva, for instance, may be considered eccentric instead of abnormal. In general, the four common features of an abnormality are deviance, distress, dysfunctions, and danger. Any deviation from accepted norm in a society or a culture is considered abnormal. For instance, in Western countries, taking to one's self is enough to raise a red flag. Distress. Acting unusually does not automatically make one abnormal. Dysfunction. Another test of abnormality is whether a behavior causes a dysfunction in everyday activities. Danger. Whenever an individual poses a risk of danger to himself or others, then it must it most likely that she is abnormal. Now let us discuss further details about these things. Psychological abnormality refers to behave through the emotions that are unusual, cause significant distress or dysfunction, and deviate from societal norms and standards of acceptable conduct. It's not a disorder in itself, but often indicates a possible mental disorder characterized by persistent dysfunctional pattern that significantly interferes with the individual's ability to function in daily life. Classification of psychological abnormality relies on combination of criteria, most notably the four Ds: deviance, distress, dysfunction, and danger. Now, let us discuss the definition. Psychological abnormality is a debated concept but is generally involves behaviors, thoughts, and emotions that are out of the ordinary, cause harm or significant interference in person's life, and are considered problematic within their cultural context. Criteria for Criteria for abnormality, that is 4Ds. The 4Ds for assessing psychological abnormality are deviance, distress, dysfunction, and danger. These criteria help mental health professionals determine if a behavior or mental state is considered abnormal by considering if it is unusual, that is deviant, causes significant negative emotions, distress, interferes with the daily life dysfunctions, or poses a risk on oneself or others, danger. Most contemporary dysfunctions of psychological abnormality include the four key aspects: deviance, behavior that differs significantly from what is considered normal or acceptable within a given society or culture; distress, emotional pain, upset, or suffering experienced by the individuals due to their thoughts, feelings, or behaviors; dysfunction, interference with the ability to conduct daily activities in a healthy and productive way, impacting work, relationships, and self care; danger, behavior that poses a risk of harm to oneself or others; classification. While there is not a single universally accepted definition of abnormality, psychologists classify psychological disorders based on these criteria and by using diagnostic manuals like the Diagnostic and Statistical Manual of Mental Disorder, this DSM. Examples of classified psychological disorders include anxiety disorder, such as generalized anxiety disorder, social anxiety disorder, and panic disorder. Anxiety disorder or mental health conditions marked by persistent excessive fear and worry that interfere with daily life, causing significant distress and impairment. They are among the most common mental health conditions globally, encompassing various disorders like generalized anxiety disorder, panic disorder, social anxiety disorder. Core features include heightened fear responses, avoidance behaviors, and physical symptoms such as muscle tension and fatigue. Genetic factors, environmental stressors, and brain chemistry all play a role in their development, and effective treatments, including psychotherapy and medications, are available. Mood disorder, what is that? Including depression and bipolar disorder. These are mood disorder. Mood disorder are psychological conditions characterized by significant disruptive changes in a person's emotional taste, energy levels, and behavior, such as depression or bipolar disorder. Common symptoms include persistent sadness or emptiness, irritability, sleep and appetite changes, lack of energy, and loss of interest in activities. They stem from a mix of biological, genetic, psychological, and environmental factors and are treated through therapy, medications, and other strategies. Neurodevelopmental disorder, like intellectual disability and autism spectrum disorder. Neurodevelopmental disorders are conditions characterized by abnormal brain development leading to impairment in intellectual, motor, language, social, or behavioral functions that typically emerge during the developmental period. They differ from psychological abnormalities in that they have a clear neurological basis and originate in childhood. Common examples include autism spectrum disorder, ACSD, attention deficit or hyperactivity disorder, ADHD, intellectual disability, and specific learning disorders. Psychological abnormalities are broader and refer to behaviors or mental states causing significant distress, which can stem from various causes, including neurodevelopmental disorder. Next one, personality disorders, such as borderline personality disorder and avoidant personality disorders. Personality disorders are mental health conditions characterized by enduring, pervasive, and inflexible pattern of thinking, feeling, and behaving that deviate from cultural expectations, causing significant distress or impairment in a person's life. They are considered psychological abnormalities because they are deviant, distressing, and dysfunctional pattern of behavior, thoughts, and emotions that interfere with person's ability to function. Common types of include antisocial, borderline, histrionic, and narcissistic personality disorders, often requiring long term treatment, which may include psychotherapy and, in some cases, medication. Substance use disorder, such as alcohol and opioid use disorders. Substance use disorder SUD is a medical condition where a person has uncontrolled substance use despite harmful consequences leading to impaired brain functions, behavioral changes, and severe psychological and physical distress. It is considered a psychological abnormality because it affects the brain, leading to distorted thinking, intense cravings, and personality shifts. People with SUDs often experience co occurring mental health conditions like depressions and anxiety and may struggle with daily functioning, but it is a treatable condition. So far, we discussed a little about some disorders. That means psychological abnormality in the definition and classification of abnormality. We have done. Please subscribe our YouTube channel.